All right, we are live with our next discussion about careers in healthcare for National Health Professions Week. My name is Brian Stewart, and I work at the Montgomery County Educational Service Center and also the nonprofit Learn to Earn Dayton. And thankfully, with partnership with the Greater Dayton Area Hospital Association and so many other healthcare providers, we're talking to professionals in our community about careers in healthcare. Now, this was supposed to be a panel, but because we're in the middle of a pandemic, things are popping up, and Dr. Hardy is no longer able to join us. He has to deal with some things at the VA, but we're so excited because that just gives us more time to speak with Michelle. So, Michelle, we're excited to have you. I introduced myself. I'm going to go ahead and toss the mic over to Madison, who you may have already seen during our Dayton Children's panel. But Madison has a unique story in it's herself as well. So I'm going to pass it over to Madison, and then we're going to get started with Michelle.
Thanks, Brian. Yeah, hi, everybody. As Brian said, my name is Madison, and I work with the Dayton Regional STEM Center. I'm in AmeriCorps Vista, so I will be working here for a year. And I actually am working for a year as AmeriCorps Vista while I take a gap year, and I will be going to medical school next year. So I've really enjoyed talking to all of our panelists and getting their inside scoop on medicine. And so now we can pass it on over to Michelle and have you just quickly introduce yourself as well.
Yeah, not a problem. Hello, everyone. I'm Michelle Logan. I am a staff sergeant in the United States Air Force Reserves and was asked to come on here today and to speak to everybody about military careers, how it correlates to the civilian side, and some additional things. So I know that we have quite a few questions I'll be answering and backstory to tell you how I got here. So, I'll just let my two other hosts take it away. And if you have questions or whatever we need to do, just glad that I could be here to help.
So I feel like so often when we talk with students, they don't know what they don't know. So I thought we'd start off by just learning about what do you do? What is your job? And, how did you get there?
Okay. So for me, I graduated college in 2008 from Wright State University. I actually graduated with a degree in criminal justice, and my intent was to go out into this world and save people. I just wanted to help people. That's what I wanted to do. I just didn't know how to do it. So I was in the criminal justice world. I worked in probations and then shortly moved to Montgomery County Juvenile Courts in downtown Dayton. So I worked in a intervention center, which was the first step response to officers apprehending the criminals, bringing them in. I got to book them in, take their mugshots, and it was essentially my job as an early 20-year-old to determine if a kid was going to have a permanent record or an unofficial record that could essentially change your life. So my job was to provide disposition to the unofficial hearings, which could include anywhere from drug screenings to writing in a journal to mental health assessments and whatnot. So I did that for several years and found that it wasn't for me. I wasn't happy and I needed something else. And a lot of my friends were in the medical field. And I thought to myself, well, why didn't my friends in college just tell me, go in the medical field? Well, hindsight's always 2020. So instead, what happened was I decided to leave the courts. I went into the United States Air Force Reserves. My job is a 4NO. It's considered an aerospace medical technician. So 4NO is just the easy way of military people talking to each other, saying, this is what my job is. So I became a medical technician, went down to Texas, was gone for about 9 months, and came back home. And the cool thing about what I chose to do, which is the reserves, is I could still have my civilian life. I could still do the things that I want to do, but still have that need to serve. I had that want to serve. I'm fourth generation military service member, so I just felt like it's been in my blood. It was something that I wanted to do for a long time right after 9/11 and just didn't essentially do it for that purpose. My dad asked me, he said, will you please go to college? Please go to college. And so I did. And I waited, and being part of a team the majority of my life, I was a Division I college athlete. I just decided, you know what, now's the time. So I went in a lot later in life. I went into the military at 27 as the age that I raised my hand, and I left at 28 and came back, and I love it. I think it's one of the coolest things that you could do. So being in the medical field in the military led me to be an outpatient physical rehabilitation. So I started working with a bunch of patients that had surgeries, whether it was like a knee surgery or shoulder surgery. It could be pretty much anything where you have to go to physical therapy. So I worked there for a little while, and something that a lot of you will shortly learn in your life is that this world is all about who you know. So I had one of my friends reach out to me and say, "Hey, do you want to do something else?" And I said, "Yes, I do. I'm tired of being in a box." And so he said, "Come on over." And I started working in durable medical equipment, excuse me. So now I help 20, 25 orthopedic surgeons in Dayton. I do total joint replacements mostly, some shoulder surgeries, ACL. So it just depends on what type of surgery they need. But I do provide the medical equipment to the patients that actually need it to get better, to do the rehabilitation purpose. So instead, moving from a criminal justice world doesn't mean that you always have to stay in the first thing that you pick. You have the opportunity and the availability to do whatever you want. You just have to make sure that when the opportunity presents itself, put that foot through that door. Try everything. There's a lot of different jobs that you can do in the military that correlate to the outside world, especially medical. One of the biggest things we've learned with medical is you have to be willing to learn, one, and two, don't be afraid to fail. Because with medical, you will always need somebody to help take care of you. Robots can help, they can be tools, but that doesn't mean that a real live touch from a doctor or somebody that's going to be able to assess you is going to take, a robot will never take place of that. So, my story is a little bit different. It's a really long story, but I can tell you that till this day, I absolutely love what I do. I'm glad that I've done the stuff that I did in the past that allowed me to be more positive about helping people and be able to help them change their lives. Because with criminal justice, it wasn't, you didn't see the progress that you wanted to. So instead, being in the medical field, it's never ending. They're always going to need you. So if the opportunity presents itself, always try it.
So you have already alluded to this a little bit, talking about your career and your path to your career, but what's one of your favorite things about your job? Why do you really love what you do right now?
So for I say my primary job. I also do a couple other things, but my medical job, I love it. I think it is one of the coolest things. You get to come into contact with so many different people, and I know that right now with COVID-19, it's not ideal. It's not what it used to be before. However, there's still a lot of us out there that are still working. We're still seeing patients. A lot of these patients that I come across, they have their own story about how they got to where they are, and being able to listen to them and then to see them before they recover and then seeing them after they've had their recovery, to see the amount of progress that they've made. You're looking at intrinsic motivation, something that somebody is at their worst and then you're seeing them close to being their best. It's one of the coolest things that you can see, because progress is one of the biggest things that I like to feed off of. I like to see people, I like to see people change. I like to see people change for the better. And it's one of those, it's a double blade sword sometimes, because, not everybody's going to make it, but, in working in an outpatient field with patients having these surgeries, you're able to see the progress that they're making in such a short period of time. I'm sure that there's a lot of you out there that have had family members that have had surgeries, and you've seen them right after surgery. They are not happy. But when you see them 4 to 6 weeks later and you're like, wow, okay, you look really good. I'm proud of you and everything that you've done. So seeing the progress is probably the number one thing.
So one of the things that we wanted to talk with you about, and the reason that we designed to have this discussion around military and going into careers through the military, but getting into healthcare while you do it, is just because so often students will eventually hear from military recruiters. But we wanted to talk specifically during Health Professions Week about the opportunities to go into medicine through the military. So if you can speak about that at all, we'd really appreciate it.
Yeah, so with the military, everybody always gets so scared about these recruiters. That's the number one thing. Your parents will tell you, don't go to the recruiter's office, don't sign any paperwork, unless you know what's really going on. I'll tell you, there are so many opportunities in the military. So a lot of people think that you're giving up your life for a long period of time, and you're not. you go through school for however many years, 12 years, 13, if you want to include kindergarten, right? You go to college, another 4. So you're looking at 17, 18 years that you've been spending in school. What's another 4 years at that point? Well, the coolest thing I believe about the military is not only are you able to go and to learn team camaraderie, team building activities, but you also get a career. So you can go in the medical field. There's a bunch of different jobs that you can get, whether it's from being a dental tech to a phlebotomist to an x-ray technician. Even something as simple as my job. I'm a medical technician. We call ourselves a jack of all trade, master of none, because we do everything. I mean, from taking blood to giving shots, optometry, dental, assisting. I mean, there's all kinds of different things that we can do. And a lot of times when you're in the military, you just assume like, oh, I just have one job. I'm always going to have that one job. While you're in the military, whether it's active reserve or guard, you can cross train. So if you find that maybe one job's not for you, you can always cross train into something else. Let's say you get into the medical field and you're like myself and you're a medical technician and you decide, you know what, I really like teeth. I want to go to dental. Well, you know what, there's the opportunity. As long as that there's an open position for you, a lot of times recruiters can get you to wherever you want. You just have to be a person that's a go-getter. You're willing to change your path and not be afraid. Again, that's the number one thing. Don't be afraid to fail. If you want to do something, the military does provide opportunities, and not even just career, but they also provide you housing, a stipend for housing. They also provide you a stipend for food, wherever you're at, whether you're here in America or you're deployed somewhere overseas. There's always some way that you're going to be paid. So that way, even if you're in the military and you're serving, it's essentially a full-time job while you're being trained. So even when you're at school, you're getting paid as if it's a full-time job. It's one of the best things that you can do. There's nowhere else in America that provides you something else like that, because even if you decide to go to college, and I'm not saying don't go to college, I absolutely think everybody should go to college. Get a degree, whether it's an associate's, a bachelor's, or something higher than that. But with the military, you're able to go and you're able to see a lot of different things, experience, travel the world while also gaining a career. And on top of that, you're also able to pay your bills as well.
So what you've been talking about actually works really well with a question that we had from a student. So the student's name is Susan. She's an 11th grader at Dunbar. And she asked, are there options for students that don't want to go into 12 years of healthcare education, but do want to go into medicine?
Yes, there is actually. So one of the biggest things that there is number one, you got to be in the military. So, you'd have to go to basic training. That's number one. If you don't already have a degree, that's not commissionable. Commissionable means that you're an officer. So instead, you have two different types. You have officer and then you have enlisted. If you're an enlisted member like myself, when you come in, what you can do is there's a bunch of different programs that you can apply for. So let's say, for example, you come into the military or in some sort of medical field. It doesn't matter what medical field it's in. But what you can do is you can apply to go to PA school. You can apply to be a physical therapist. You can apply to be a nurse practitioner. You can apply to be all these different things. And on top of that, if you decide that that's a route that you want to go, there's funding for it. So a lot of these military programs that they have, not only would you be serving your country, showing up, and then you do whatever your job is every single day, you can apply to go to school. When you apply to go to school, the military still pays you 100% of whatever your rank level is. I believe it's a staff sergeant or a tech sergeant. They send you to physician's assistant school. You go there, you do your didactics, which is all your book work, and then they send you to a different base. It could be one of like 7 or 8 bases that are around the country. California, Florida, Wright Pat is one of them. There's a bunch of different bases that you could go to work on your hands-on skills or being with patients. You don't have to essentially do all these years of schooling. For example, one of my cousins is a pediatrician at Children's Medical. She did her 12 years, and then she did her 4 years, and then she did her not her doctorate. She went to Wright State Medical School. So she went there and then she had to do her residency. And, it's like, shabam, there's your whole life, 30 years of your life, you just spent in school, and you're like, I have to pay these bills. So a lot of times when people are coming out and they're getting these degrees, don't get me wrong, it's amazing to have these degrees, but it's also amazing to come out when you don't have any debt. That's the biggest thing. Start living your life when you want to live it instead of having to pay somebody back later on in life. So the military does provide opportunities like that. Yes.
I think a good moral of the story for the last two answers is that if you really have something you want to do, the military can help you get there. You've got a path.
Absolutely.
So I've got a question for you because, for some of the members of our audience, they might be completely unfamiliar with the acronym soup that the military can be and what exactly an aerospace medicine squadron is. So when I see USAF Reserves 445 Airlift Wing, what is that exactly? And what is the Aerospace Medicine Squadron?
Yeah, it's a lot of numbers on there. So the 445th is actually Wright-Patterson Air Force Base. We have a reserve unit based on the backside of the base. If anybody ever drives around the base, you see these big C-17s. I mean, they're flying fortresses. They're huge. Those are our babies. So when we say our babies, they're not that little. So the C-17s are our babies. Our job as aerospace medical technician, our job in AMDS, Aerospace Medical Squadron, the job is to make sure that all around 2,000 reservists have everything that they need to deploy. What that means is you have to have all your shots, your dental has to be updated, you have to see a flight surgeon, you have to have your EKGs, so you have to test your heart, pulmonary function testing, make sure you can breathe. You have to make sure that you have your hearing test done. There's a lot of different things that go into making sure that somebody can deploy at a drop of a hat's notice anywhere around the world. Our C-17s can be around the world, and we're talking a matter of hours. And somebody that needs to get on that plane, whether we have to go pick up a wounded warrior or wounded soldier, to transporting people back from different parts of the world, or helping to pick up refugees, there's a lot of different things that we can do. So as an aerospace medical squadron, we're able to provide that to all 2,000 some reservists. And the bigger picture to this is not even what we do. It's what the mission of the 445th is, and that is to essentially be able to deploy anywhere to help anybody at the drop of a hat. We want to go out, we want to help people. If there's an emergency, if there's a tornado, or if there's a hurricane or something and people need help, or if we need to move supplies, yeah, call us up. I mean, that's the main thing. We're able to put tanks on our planes. We're able to put people who can jump in out of parachutes. We're able to turn the C-17s into a makeshift hospital. I mean, we're allowed to do all these different things with our planes just because of the technology that we have. So, even though we just say sometimes we're pretty humble, we work in a hospital. When we say we work in a hospital, the bigger picture to that is we take care of our people who then take care of the bigger picture.
And we do want to say that we really do thank you for that work and everything that you do. And so our next question is maybe backing up a little bit from what you're doing right now. And we want to know what you wish you had known before starting your career.
Oh, that's a good question. I don't think I've ever been asked that. What would have wished I would have known? I would have wished I would have networked more. I would have been less afraid to try things. I wish I would have put my foot through the door when multiple opportunities arise. And I think that's the biggest thing that I like to share with people today, because hindsight's 2020. I wish I would have done this is usually what people say. Oh, we get old and we get gray, and we say, I wish I would have done this. And I wish I would have listened to my best friends in college when they told me I needed to be in the medical field. I wish I would have known that, because I probably would be in a different place today. But I can tell you this, I have no regrets. I'm glad that I did the stuff that I did as a young 20-year-old, working for the courts, leaving and going into the military, working outpatient physical therapy, and then moving into the durable medical equipment world. I mean, that's what I do. And on top of that, if I wouldn't have learned those things at an early age, one, I wouldn't have learned what it was like to have good bosses and bad bosses. I wouldn't have learned what it was like for myself and how to treat other people with respect, working in the courts. On top of being in the medical field, I also own a gymnastics gym, a nonprofit, and I also own a properties group. So I don't think I would have had any of that if I wouldn't have done the stuff that I did. So, when you have an advantage to do something, just try it. I wish I would have tried a lot of things when I was younger. I wish I would have, called and applied for other jobs. I wish I would have done stuff like that. But, that, again, wouldn't have led me to where I am today.
What is a misconception about going into the reserves and kind of taking the path that you found yourself taking? What are some misconceptions that students might be told throughout their educational journey that you might want to provide your own perspective on?
So the reserves, I think, is probably one of the coolest opportunities that you can get. So let's break down. Active duty is full time. We have reserve, which is part time. Then you also have the guard, which is also part time. So you have the reserve and the guard, which people correlate together. They are different pots of money. So the state guard is mandated by the state. They're funded by the state. The reserve is funded federally from the federal government. So one of the things that people, I say, shun reservists for is that we're part-timers. So they say, oh, you're part-time here and whatnot. But what they fail to forget is I'm over here running 3 businesses. So on top of being in the reserve, which I don't have to be, I choose to be because I feel like it's in my blood. It's my nature. I had this call to serve. So I wanted to do that. I think as a reservist, a lot of times people will tell you that, you're not real military. And we still go in, we still do the same exact things that active duty does. And instead of doing it in a week, we fit all of this into 2 days in 1 month. So we show up, it's usually 6, 7 o'clock in the morning. We don't leave until 4 or 5. And this is Saturday and Sundays, 1 week in a month, 2 weeks a year. So the cool thing about being in the reserve is not only can you have your civilian life, as a reservist, when you do your 1 week in a month, 2 weeks a year, you're still looking at 24 Saturdays and Sundays, and you miss birthdays and you miss things like that. But you know what? That's something that we choose to do. But you also have annual tour, which is another 15 days where you can go anywhere you want if there's availability, and funding on top of that is usually the main thing. But you can go and you can still see a lot of different things. Just because you're in the reserves doesn't mean that you're stuck at your base. You can go to a lot of different places. I've gone and I've worked at different bases in different states, and I've had experiences in other places. But for the reservists, a lot of times the active duty, I love them. They're our counterparts, but they just forget that we're not just there on the weekends. We're still working a 9 to 5, or in my case, I'm working a 6 to 8 and still doing my military duty. I enjoy it. It's something that I love to do. And if I didn't love it, I wouldn't do it anymore.
So Madison, I don't know if you have any questions for Michelle specifically, but really one of the things that I was going to ask you about was, how has COVID-19 impacted the work that you're doing?
So when COVID-19 started, they shut down elective surgeries. So, you have different worlds. You have people that work in hospitals, you have people that work outpatient settings. You also have people that work in clinics. So when you're looking at COVID-19, especially with what I specifically do in the medical field, so durable medical equipment, what we had to go through was they shut down all the elective surgeries. They essentially shut them all down because they needed to take all the equipment that they had, and they needed to shift them over to the hospitals to make sure that we had enough to take care of these patients if they were to get sick. So with COVID-19, I think there was a stint of maybe about 2 months we were completely shut down with elective surgeries, just because you never know what somebody has been exposed to. So instead, what you want to do is be able to try to contain and maintain the amount of people that you have coming in. So even with the military, we actually went from in person to digital. And let me tell you, that was one of the weirdest things, showing up on a Microsoft Teams call, for a weekend and say, well, this is what I did. And it's like, wow, I would rather be in the hospital actually working and seeing people. So with COVID-19, not only did it take a toll on a lot of people mentally, but physically as well. And it's something that's still going on to this day, where we don't know enough about it. And so instead, the best thing that we can do is try to keep each other safe, try to be respectful of each other, wear a mask, PPE, wash your hands. That's the biggest thing. Wash your hands and don't touch your face. And we see that a lot. But even with the military, we're able to stress that when we see each other on the weekends now, and it's not very often, we are back in person, seeing each other and doing the work that we do. But in the civilian side, it's still going on to this day. You have to have certain negative tests, or you can't test positive. If you do, you can't have surgery, and so that's cutting down on your patient load. But it just depends. Hospitals are going to be different than outpatient surgical sites or surgical hospitals. But life goes on, apparently. But with a lot of these patients, this is a risk that they're willing to take. If they need surgery, if you have a broken hip, you don't really have a choice. You're going to have surgery. It's not an elective. But if you have somebody like the majority of my patients that are total knee replacements, that's elective. Unless you've gotten to a car accident, you've had some traumatic experience. I mean, it goes on. We'll figure out how to make it work. In modern medicine, we have the best technology here in America, and I'm sure that at some point they're going to have a vaccine, or they're going to have some sort of way to help society, or I guess, subdue some of the symptoms that a lot of these patients are having, and provide them immune boosters to at least try to help them along the way.
Definitely. We're all hoping for the best. So clearly this job is something that you really enjoy, you feel like is the right path for you. But even with all of the jobs that we love, there's some parts that aren't our favorites. So we've had a couple questions about what's like the toughest part of your job, what's the hardest for you?
The toughest part of my job as a civilian side is seeing some of these patients, and you see them. I'll use one lady, for example. I had her probably 2-3 years ago. I always remember this. Showed up to her house to deliver her medical equipment, and sweetest lady, super nice, super kind, healthy. I mean, she was a little bit overweight for the surgery, but she'd said she had been working hard, she had been losing weight, and she was she was glowing, she was happy, she was ready to have the surgery. And a couple weeks later, I get a phone call that says that she had passed away, and I thought, how? She's so healthy. Like, what are you talking about? So there's a lot of different things that could play into something like that and losing a patient. Even though I wasn't directly affiliated with the loss of the patient, or wasn't there, the family did call, and they said that after she had surgery, there's our bodies are pressurized. So we have blood, and blood works. We perfuse oxygen, you breathe oxygen, it's got to go. And it's all, biological. So this patient, apparently her blood pressure bottomed out. The medication that she had dropped her blood pressure so low that her heart just stopped. And I thought to myself, I just saw her. And it was a hard loss for me, because that was one of the first times that I had ever lost a patient in an elective surgery world. So you're going to see a lot of these patients that are very healthy to begin with, and then all of a sudden something just happens, and you lose them. And I think that's for any world, whether you're in the medical field or whether you're just in life in general. We could be out there driving a car and something happened to us, and then all of a sudden you're gone. Your family member is gone. So I think the hardest part for me is the loss of any patient or any life, especially somebody who's wanting to make their life better. I think that, it's a terrible thing that happens, but the only thing that you can do from that point is just try to learn from it, share your experiences with everybody. So that way, if you have a patient, and I do tell them, like, hey, make sure that you watch your pain medication, because, you want to be coherent. If you're not coherent and your heart's not pumping, well, that's kind of end game. But a lot of these patients, they don't think of it that way. They think of it as, oh, I've had surgery, I have to take my pain medication, but they need to correlate with their doctor to make sure that all their medications work properly together.
What question or what advice do you have for middle school or high school students in the greater Dayton area that have heard some stuff during Health Professions Week and said, I really am pretty curious about going into this industry. I think I might want to go into this industry. What advice would you have for them moving forward?
Use the internet. You all have the ability to literally go on Google and type it in. And you can watch all the videos on YouTube, just like this. You can look at Wikipedia, it'll give you information. You can check out, sometimes even post the surgeries online, if you want something like that, or if you want to be a nurse practitioner, or if you want to be a physician's assistant, or if you want to be a surgeon, or if you want to be a physical therapist. There's so many different things out there. The number one thing that a lot of people don't do these days is make a phone call. If you are interested in a job, make a phone call. I know everybody likes to text, but it's so much easier and so much more personal if you make a phone call to somebody. I mean, literally Google it. Physical therapy department, skilled nursing facility, that's what you're interested in. Log on your phone and then punch it in there, and it'll give you the nearest phone number or the nearest place to you. A lot of times as younger kids, you guys don't have the ability to kind of drive around. You're not driving yet, so your families might not be able to take you places, or you might not have a way or a vehicle, a method of transportation to get somewhere. Make a phone call. Hey, can I speak to somebody in the physical therapy department? I just had a question. I'm thinking about going into this field. You will be surprised at how many people are willing to share information with you, how many people are willing to take the time to talk to you. But you have to make the effort. You have to have the intrinsic motivation to make the effort to reach out to somebody to get information. I believe it's not that hard. I think there's a lot of us. I'm a little bit older, so I'm so used to getting on Google now, where back in the day it was not Wikipedia, but it was an encyclopedia. It was a book. You opened it up, and a Yellow Pages, you open it up and you look for physical therapists, and you're like, oh, there's one right there. Nowadays you can just Google it and it's information at your hands. I think that everybody should utilize technology for what it is, because you'll be surprised at how much there is available to you and the information that you have. Don't be afraid to try it. What's the worst thing that's going to happen? You're going to call somebody, you're going to ask a question. They don't even know who you are. So call them and ask them questions. Ask them all kinds of questions. Call everybody. And so that way you at least have as much information as you can to make an informed decision for yourself.
So we're closing in on 30 minutes, which is pretty intensive interview with you. But I guess, Madison, I don't know if you have any questions, but my final question for you was, for the student that's sitting there that's gotten a wealth of information from you today, what kind of parting words do you have for them, or final words of encouragement? Because this is a scary time to be looking for a career and thinking about a job, and just, what advice do you have for them?
My advice to you is, I was born in the Philippines and came to America. I'm first generation American. I grew up in a military family. I didn't have a lot of money. And my dad told me he couldn't pay for my college, so I became an athlete. Took that, came out of college, no debt. Every door that opens, put your foot through it. If you have the opportunity, there's nothing that can hold you down. If there's a will, there's a way. I tell everybody that. If you want to do something, if you want to be successful, if you want to be the next president of America, if you want to be the next CEO, if you want to be the next nonprofit owner, if you want to do something, just do it. It's not that hard. What's the worst thing that's going to happen? You're going to fail. All of us fail. We all fail. I'm a 3rd-degree black belt. I've failed plenty of times. I've fallen down plenty of times. And the one thing that kept me going is I always had an instructor. I always had a teammate that always told me, get back up. So make sure you rely on your support. Be positive, help people. And I'm a firm believer that the more people that you know, be a kind person. You'll be surprised who's willing to help you. But the number one thing, intrinsic motivation. If you don't have it, find it. Because it's going to help you. It's going to help you be successful. It's going to help you in any and everything that you choose to do, whether it's at home, whether it's at school, whether it's at your job. If you're able to surround yourself with positive people, there's nothing that you can't accomplish. Surround yourself with a good team of people, but make sure they're like-minded like you, because you want to know that there is opportunity for you. I'm an example of it. I came from essentially nothing and decided that, one day I wanted to do everything, but the number one thing, don't be afraid to fail, intrinsic motivation.
Well, I think that's a really great thought to leave everybody with. And we want to say thank you. We know that this has been an intensive sort of question and answer session that we've had here with you. And we know clearly by your answers that you have a lot going on, both with healthcare and otherwise. We want to thank you for the work that you do in healthcare. We know that this isn't an easy position in any way, shape, or form. And Brian, I'll leave it to you if you have anything else you'd like to say.
Yeah, Michelle, thank you so much for speaking with us. It was just fascinating to hear about your life path and the different career trajectories that you had and how you got into the military and into medicine. And really, you're just a shining example of how, you just innovate as life keeps going on. So just a thank you to any of our students watching right now, any of our teachers that are checking out the panels that we're putting on. Thank you for participating in Health Professions Week. We have lots more to offer between more panels with Sinclair on Thursday. We've got all sorts of videos and activities up on the Health Professions Week website. There's a virtual career fair. We even have all sorts of open house nights at Miami Valley CTC and more. So please go ahead and check out our website. And if there's anything that you take away from this week, we hope that it's this. There are more careers in healthcare than just doctors and nurses. And like Michelle said, don't be afraid to reach out and learn about those various careers. So Michelle, thank you so much. And we'll see you all in some of our other activities this week. Thanks, Michelle.
Thanks.
All right, we ended the live stream. Thank